So I saw a recent statistic in the Harvard Business Review, and it indicated that by 2026, global corporate spending on wellness is set to top $94.6 billion. That is a lot of money. Sadly, though,
Yeah.
at the same time, mental health and well-being are declining. So what does that actually mean? That means that billions of days are lost to sick leave, to underperformance, to decreased productivity. What the heck is a company supposed to do about that? It's a big problem out there. I'm Robin Strongin, and I'm here to talk on Health Dame today with two experts, both of whom decided enough is enough, and they're going to do something about this challenge that's really impacting anybody who is working, particularly in a workplace where there's a lot of stress, where there's a lot of demands, where work-life balance is tricky, and who isn't challenged by that. So I am really delighted to welcome two amazing women, fierce people who just decided we can really do something about this. So please welcome Libby Burstein and Ali Schroer. I am so thrilled that you guys are here today, and I'm going to ask you each to introduce yourself. Ali, why don't we start with you?
Wonderful. Thank you so much, Robin. Thanks for having me. And I agree with everything you said. It is a big problem. And that's why my practice, my firm is called Mental Scope Consulting. And we are really set up to help support the well being and the mental health efforts in corporate America. So we do work with high achieving organizations, as you said. A lot of type A kind of gunner personalities out there that are really trying to make a difference in their own industries. And our job is really to come in and help assess and figure out what can we do so that we're not spending billions of dollars on well-being and mental health, but we can infiltrate the system within that organization, both from kind of that internal lens, thinking about that cultural piece and maybe the leadership piece, as well as the more reactive piece of how do we support people when they do have mental health challenges or when they do have well-being things going on in their worlds. And so we do both of those pieces and work with organizations to kind of better that goal and that initiative.
And one of those organizations, Libby, is Faegre. So I'm going to ask you to introduce yourself, and then when we get to the question of what is an organization, what is a corporation, a company to do, as a case study, I wanted to talk about how you guys decided to tackle this because it is a tough issue, stigma and everything. And before we dive in and get too far afield, introduce yourself, Libby.
Sure. Thanks for having me, Robin. And it's really nice to be here with Allie, who you'll soon come to find is related to me, or I'm related to her as sisters because we speak very similarly. So I'm a partner at Faegre Drinker Law Firm. I grew up with my wonderful sister Allie, and I live in Washington. All of those things gave me a unique lens on mental health in corporate America. I am not licensed clinical social worker. I'm just a lawyer. And I get to do a lot of things in healthcare. I've had the pleasure of working with you, Robin, over the years on things like internet pharmacy safety, counterfeit drugs, supply chain, patient access to medicine. So I could talk all day about those
Me
things,
too, but we'll give
right?
you a
I
break,
know.
Allie.
But the thing that really has been capturing my attention and as a leader in a law firm, my concern is the need to have a focused effort on corporate mental health. And you mentioned gunners and high achieving and type AL. Yeah, we work at a top 100 and in some cases big law firm in the world thinking about how to solve our clients' problems. And we are in the stress transfer business. People hand me their hardest things and they expect me to solve it. I love that. Like, I actually love that. That gives me a lot of sense of self. And it means I'm in a really high stress job. And so when push comes to shove, we need to have a support system inside the law firm to recognize the unique cultural and personality challenges of our day-to-day interaction so that we can be successful in taking that stress from our clients and solving their most difficult problems.
Do you guys define mental health in a particular way? I've heard the word stress and anxiety and type A personality. Mental health, of course, means many things. So if we're framing this conversation in a corporate setting, It's a two-part question. The first is what do each of you mean when you say mental health as it relates to this conversation? Let's start with that question first. Allie, maybe you
Go
want
ahead,
to
Al.
go first.
Sure. Yeah, usually when I think about mental health, I think about it first from the wellness side. So I'm thinking about kind of that upstream. We want things to be going well, functioning well, feeling happy and joy, and really kind of the whole gamut of our emotions, but that we always are continuing to come back to our status quo of feeling pretty content. If we are not feeling content, or if we're kind of on that other side, if you will, then we're looking at when our mental health or our well-being is negatively impacting our daily functioning. And that's when I start to think about, especially in corporate America and in law firms, that we need to be kind of more proactive in reaching those people. And so if your mental health, if your kind of daily status quo is not contentment, it's maybe a lot of stress or burnout or anxiety or depression, or really truly even mental health diagnoses, right? We can look at it from that lens and say that's really what we're trying to approach, and to kind of push those people and upstream those people so that they can feel that contentment, that joy, the happiness, kind of that whole gamut again of their emotions.
And Libby, how
Yeah.
does that translate to what you see going on in your firm?
Yeah, I think it's in every workplace. I just happen to have a perspective on it, and really was in highlighted in the pandemic when you started to really see people where
Ah,
they are.
yeah,
And suddenly, like, the backstage comes to the front of the house, and you're,
yeah.
oh, wow, you have screaming children in the background and two, sick parents with you, and no place to go, and it's all in your face all the time. And that really speaks to Allie's point about like the whole person being able to thrive or sometimes just survive in an environment that requires a a lot of any individual. And so for me, whether it's in a law firm, I was seeing it in my clients or even in my friends, it's I think it's about the ability just to be, I like your word, Al, content, but also just thriving sometimes a really dynamic environments. And I mean, Faegre is a wonderful place to work, and I could give a commercial for Faegre Drinker, but I won't, because I think it's really about how do we make sure that anybody where they are has the tools that they need, mentally, physically, socially, spiritually, as you see, to survive and hopefully feel content and thrive.
So in the past, there have been wellness programs that corporations have used, businesses have used EAPs, right? Employee assistance programs, and they're notoriously not working, frustrating, under-resourced, whatever the issue. There was a lot of stigma associated. Certain professions make it hard to ask for help, particularly or at least they used to. I
Yeah.
do think since COVID, there is more of an openness because, as you said, Libby, it was in our face. There was just no avoiding it.
Yep.
People were seeing your life and then some. But how how have the employees, um, taken to this whole idea
Yeah.
that not only are there tools, but that there's a need? Is this something people are looking forward to? Are they having trouble asking for help? But, some people ask for
Yeah.
help all the time, and others, would rather stick needles in their eye.
Uh,
It's
well,
like the brain.
I have a feeling Allie's got some real insight on this from a
Yeah.
lawyer population. And Mike could have an anecdote, but I'll let you go first, Al.
Sure. I was going to say, I think it really spreads the gamut. I think some of it is the culture of an organization. I think a lot of it is how it is set up. So if I look at my practice, Mental Scope, versus maybe an EAP or some of the other organizations that are out there trying to address this, we're addressing the same issue in very, very different capacities and
Ah,
very different ways. And so I think if you go back, Robin, to that traditional route of saying, like, hey, we have some benefits for your mental health, good luck. They
yeah,
are underutilized still. The people are not taking advantage of those. They don't know if it's confidential. They don't
right.
know who sees what. They don't even know, quite honestly, how much red tape is involved to access those. And so
Yep.
that's a huge barrier. And then now more organizations are trying to get apps, and they're trying to do things so that there's confidentiality, but yet it's kind of in this web-based form.
Yeah.
I think I see all over the map. Some are successful. some are not. And it does come back to how is it advertised internally? How is it promoted and utilized by leadership is a big piece of it as well. And so what I would say is, what my practice does is a little bit different in terms of we are working truly kind of integrated into an organization so that we break down some of those barriers. We make it really easy.
What does that look like to someone like me? Like just a high level example of what you mean by integrating. Does everybody get together? What does it look like?
Yeah, great question. So it can look a whole host of different ways depending on the size of the organization, but kind of a high level would be that I work with the leadership team, the executive team of some sort. I can work with them individually on some of their own stuff. And I also work with them on how to infiltrate the culture through workshops and small group activities, through health assessments, trying to understand what that organization needs. And essentially, I have access to the organization. One of the things somebody said years ago to me, you're kind of like the flow of progressive. You come around and you say, hi, how are you? Hi, how are you? And I try to be known within an organization, or anybody from my firm tries to be known within the organization, so that we feel like we are in touch and really understanding.
So a personal connection is really critical.
It's really important for trust. I mean, I'm speaking as a lawyer. We are risk-averse, high anxiety professions who I did not realize how unique, at least Washington culture is. And I'll just speak to the audience that maybe, Robin, well. Washington is kind of a high energy environment. Probably your listeners are high energy people that want to do things in the world and don't spend a lot of time in self-reflection. So if you don't have a constant reminder that there's the flow from there's Allie, we have a mental health and well-being program. It's accessible. It's constantly kind of in your face.
And it's confidential.
It's confidential. It's also lauded by the leadership. We're kind of breaking down barriers to entry. And I think when we launched this program with Allie back in 2021, what was really important is we had full leadership buy-in. And we started this We Are Human series to really create vulnerability, which then builds trust across the organization.
Still trying to picture the lawyers I know doing this. And some of them I think would really love it. And some of them would hide under their desks, but
freak out.
You never know until you're faced with it.
So that is, I think, a really important point, Robin. And an example, if you were working at Faegre Drinker, Allie may say Robin's a leader. People love and trust Robin, right? And so one way to break down that barrier to destigmatize it would be, Robin, come and let's have this interview in front of the law firm, and we're gonna just tape it, confidential, only accessible by the employees. But Robin, tell me about the hard times of your life. Tell me about your menopause journey. Tell me about the time you had to cancel a trip, right? Any version of those vulnerability moments allow people to see we are actually all human, which means we are going to have ups and downs in our day, which makes us better professionals to each other. And I have real life examples of this, which then makes us better for, at least in my world, clients. And this all gets back to client service in our world, but it's about just solving a problem.
And I will say one thing that I do think timing is everything. And I think that some of the stigma associated with certain discussions that whether their employees or anybody wants to have, mental health was always very much kept private. But I really think the way people share just about everything and then some on social media has not just broken barriers, I think they've obliterated some.
No such thing as boundaries anymore.
Oh my God, none whatsoever. And so but I think it's not always a good thing, but in this instance, I think people are much more comfortable talking about things that they couldn't imagine talking about 10 years ago, for example.
I also think that, especially when we look at it from the corporate lens and from kind of those high achievers again, is that the messaging around it, at least that I say in my practice, we talk about, especially even at Faegre Drinker as a client of ours, is that we talk about my job is to help take care of your brain so that you can take care of your clients. And so we start to kind of look at mental health, back to your question earlier, Robin, of like, not just when things are going terribly and you're sitting in the mud and the world is falling apart around you, but how can we be more proactive upstream, use this as tune-ups, right? Like, hey, you have a huge trial coming up and you're going to be away from your family for
So there's
2
a
months.
business case. Yeah.
Right.
There is absolutely a business case to this. And I can say, hey, Joe Schmo, you're going to be living in New York for 2 months doing this trial, and it's going to be really intensive. And you have a kid at home
That's really important. Oh,
why don't I
okay.
help you
Yeah.
prep for this, prep your family for this? And so I think some of the language around it and some of the I don't know, just acceptance of it within an organization, at least again, the ones that I work with and my team works with, is because leadership is saying, use Allie and her team in this way. Please prep yourself. Please think about your own well-being and mental health, because we expect you to show up to that trial ready to rock.
Right.
And if you're not, and there were ways to help you do so, we're missing the boat.
Well, and I keep telling our clients, like, you're buying, like, you pay by the hour most of the time for legal services.
Mm-hmm.
So my, expensive hour better be 100% valuable to you.
That's
If
right.
you do not want a half-used hour because part of my brain's thinking about my dog's sick and, oh, I didn't remember the lunch for my kid, and I'm walking into trial and, oh, did I remember the binder for the exhibits? Like, no, you get 100% of my energy, focus, and hopefully like willingness to advocate for your position for that dollar. And if I'm not doing that, like, A, I'm violating ethical obligations to my clients, like that's a bad thing. B, like, you're not going to want to hire me again. And C, like, I want to be hired because I like solving your problem. It helps me feel good. So it's like the circle of goodness here, if we can just make all those things come together. But the missing piece to this point, which Faegre is kind of piloted as a unique thing in law firms, which is now taking off. So I give a lot of credit. Because we are well above the curve on this one, is like, have someone there as your brain trainer, because you need to buy 100% of my brain, which means I need help getting it ready for the team, the fight, the job, whatever it is.
Mm-hmm.
Well, it's really the same as when you travel getting ready for a hearing, a trial, and you want to make sure there's a gym somewhere so you can work.
Right.
It's the same sort of.
That's right.
Yep.
It's a parallel, and you wouldn't want to do one and not the other because they're all going towards a very similar goal.
That's right.
Yep.
And so what are you hearing from other law firms? Are they starting to ask you about what's working, how they might, like, how do people ask for help? If other firms are interested, how does one even get started? Do you do like big HR organizations? Where does this fit?
Yeah.
Well, that's a great question and a complicated one. Because people don't really know, right? Some people house this under HR, some people house it kind of with the leadership team. What I would say and what I would recommend is that this position, the well-being position or the chief mental health officer or whatever you want to call it, right? I'm a consultant to the clients that I work with, like Faegre.
Mm-hmm.
I would say that it is housed somewhere within the leadership kind of table so that we can talk and have communications. But also that I work very closely with benefits and with HR and with, the diversity team and whoever it may be, just the people leaders. And so it is kind of its own avenue in that regard, as it should be, also because of confidentiality, in my opinion, but also needs to have access to all those different pieces in those worlds. And so how people get started, I would say, with myself, it would be contacting me and my firm, right? That's easy. But with other kind of places, EAPs are starting to think about this a little bit more. There are different mental health organizations that are starting to try to figure out how to fit within corporate America in some form or fashion. Maybe it's having a consultant, maybe it's using an app that's kind of tailored to that organization. So it looks a little bit different, kind of depending on what you're looking for.
Does the size of the firm, I assume you customize to some extent to the needs of the organization or the company.
You have to. That's what makes you good.
With.
Yes.
So that you're meeting the needs. And so that leads me to ask, I guess, Libby, when you were thinking about this, were there 2 or 3 top metrics that you had in mind? Like how do you measure if this is working. And
I love that question.
That's the $1 million question.
Well, it's a
it's a
multi-million
tough
dollar
one
question.
also, but so be it.
Right. For billion-dollar companies, it's a multi-million dollar question, and it's a really hard one. A couple ways that we would love to quantify it, but confidentiality is most important.
Sure.
So we can't say how many, leaders have you seen? Who are they? Were they going into, what did you do for them that made them so successful? We won't know that. So what can we know? We, as a leader of a law firm, we can know things like, okay, well, you've used how many employees, generally speaking,
Exactly.
professionals have utilized the service?
Mhm.
What can we see from attrition, right?
Mhm.
Just like retention, attrition, productivity. I mean, we have a lot of data on productivity because that's like the widget we sell. So we have a lot of data on productivity. The
Mhm.
other things that I think would help us as leaders understand is like from a risk management perspective, and this is really how I can sell my clients. Like you do not want a half-used brain going in doing your hard things. Like
Mhm.
that's actually a legal liability. And so, my clients understand that. They're like, yeah, I really want someone that has a brain trainer. Like that's a really good, why do we think of that? And I'm like, yeah, no kidding.
Yeah.
And so that is like just the fact that we can get our clients there and our clients sometimes are even asking us, that's an ROI for us because we can say, look, we're partnering with our clients. Multinational organizations
Sure.
are also doing this for their employees. They understand that like we are committed to the whole human at Faegre Drinker and wellness is part of our core values. Well-being is very important to us, but because it makes us more effective, and that's the ROI. And so
That's
when we're
really
winning for
cool.
clients, when we're being hired and doing executing on great work, that's my ROI. But
Mhm.
Al, you've had to do other types of reporting for organizations, so welcome your
Yeah.
thought.
I agree with all those, Libby. And I also think another one that I would never ask, again, as a therapist myself, but that happens often within organizations, and I know has happened with Faegre, is that people who have used or worked with me or used these services, they just naturally tell people and they tell leadership. They're like,
I
yeah,
had down
my
recommendations as
Oh
one.
yeah,
Yeah.
definitely got that,
and
right?
so that is also that's helpful from a buy-in standpoint from the culture, and so that people will use this and they know that it's a safe place to go. It's also really helpful to show the value of this, right? That somebody can say, gosh, something really terrible and traumatic happened in my life. Obviously, I wasn't expecting it. It was out of the blue. And Allie was there to support me. And because of that, I did X, Y, and Z, or I was able to still go help that client, or I didn't have to take a leave of absence. All
Hmm.
of those anecdotal stories are also really critical back to leadership. But oftentimes we're looking at utilization, back to Libby's point, we're looking at utilization of the services because I just provide numbers, as well as thinking about how does that kind of in comparison to or with kind of the company of attrition, retention, even measuring some organizations, law firms are measuring like happiness of their people. They're measuring from people leads as well. Are you feeling more confident in having courageous conversations? And then some of them have even asked, like, are you willing to share? You can leave it blank on kind of a
Yeah.
survey at the end of the year. Were you able to utilize any services from mental scope?
And
And of course, that's up to
do the different companies structure, like, for example, is this a benefit to the employees? Do they pay? Is there a copay? I don't understand how
Great question.
it works.
So I'm a consultant to all the organizations, and I'll use Faegre as my example here since they're crushing it. So Faegre foots the bill for all of my work, and I'm just a consultant to them. There's a set number of sessions that people can utilize me in
I
a
see.
calendar year. And then leadership also has consultation access to me 24/7 anytime, especially if there are safety concerns or concerns about somebody and their mental health. Leaders can reach out anytime, truly, and they do day or night, of like, hey, I really feel like this is not necessarily back to that. It's not an HR problem, but like, I'm really worried about this person. What am
Oh,
I supposed to do? And I say, sure, like, let's
Yeah.
jump on the call. Let's figure
that's
this out.
so great. So they have a built-in
It's super
expert.
helpful.
It's the
Oh my
easy button
God.
when it comes to mental health.
I
Correct.
gotta
Wow.
tell you, I mean, Robin, you can only imagine how many times. I mean, I grew up with a mom who's a PhD and a sister who's a social worker, and there's so much I don't know. I mean, how many times have I texted Allie in the middle of the night saying, "Okay, got another one," and like I just have a question about myself, about my friends, about my colleagues, somebody, and I knew that we had that, and I grew up in that environment, and it's still I need the reminders.
Yeah.
And so having that in-house experience, I mean, I consider Allie like our chief wellness officer. I know
I
you're a
see.
consultant for legal reasons and for confidentiality reasons, but
Yeah.
like inside Faegre, you are known as like the chief wellness officer. And we expect that people will remember to call you and we have to remind ourselves. But it is so great for leaders, it is so great for individuals, and that just a phone call away where she understands the organizational architecture. I know Robin's a great boss. I mean, I understand that that guy's really, really difficult to work with. You know, she hears things, unlike an EAP, which is
Mhm. Right.
external. And I've had experience with that too, which is it's very removed. You make it one person one time, then the next time you get a different person the next time. They don't have any cultural knowledge or institutional history. And so
Yeah.
it feels very repetitive. It's a crisis line. It's like my cat's on the roof, right?
Yeah.
Like that's the crisis line. It is not a, I need help navigating a really complex work environment because the stress I'm under as a partner in a law firm requires me to do this and this and this and this and report to this and do this. All of that knowledge helps Allie's team be highly efficient, right? Like I don't need 10 sessions to get to an answer. She can
Yeah.
give us like, oh, I got an idea. How about you do this? Have you talked to that person? Have you thought about this? Like practice this. That's from a billable hour perspective, that's
Yeah.
ROI.
But they're coming to you for the workplace challenges, but also if they're
No,
having a
No, that's
personal
life.
issue. Okay,
correct.
life
It's
challenge.
usually
The
for
other. Okay.
personal stuff that is infiltrating the work part of themselves. If it is like I'm having a hard time with Joe Schmo at, either like internally, right, as a colleague, sure, I can advise on some of that. But as a therapist, my question is going to be, why does Joe Schmo bother you so much? What is
Right.
this about for you?
Right.
And so I kind of put back on my therapy hat. I can't not. And work from that context. So
Yeah.
I would say most of the time it is not a work related issue. It's just impacting your work.
Got it.
Yep.
Got it.
Yep.
It's, part of what I love when I talk to people now is some of these solutions are hiding in plain sight, right?
Right.
It's the resources are there. You
Yes.
Yep.
just have to access them and bring them within.
Yes.
And I
Yeah.
wonder, will obviously, what I love is I'm all about smashing stigma because I think
Right.
so. My sister many years ago was an audiologist and she chose to work with elderly people. I mean, in school they worked with kids, of course, but you tend to
Yeah.
specialize. And for years and years and years and years, nobody wanted to wear hearing aids. It was a sign of old age. Well,
Right.
fast forward to Apple, and everyone has things sticking out of their ears. Like it's almost weird if you don't have some technological piece sticking out of your head walking down.
Yep.
The number of people using hearing aids has exploded because it's not a
Yep.
stigma anymore, even for
Yep.
kids. They, like everyone
Right.
has things in
A
their
great
head
example.
now. It's almost
Yes.
like if we would just normalize whatever that means,
Yeah.
asking for help, for God's sake,
Yes.
there is a business case for it, there's a human being case for it. We need
Yes.
it. The numbers are obvious. People are struggling.
Yes.
Yeah.
It is really hard out there for so many reasons, and they're different for everyone, but they're the
Yes.
same at the end of the day. And
And one of,
having the
I was just going to
ability
say,
to
yeah.
have a solution is what I really applaud. But Libby, kudos to you for helping you and your colleagues in leadership understand like this really can make a difference in so many ways for people and it's so doable. Yes,
Yeah.
there's a financial cost, but there's a cost to not doing it.
That's right.
There's a tremendous cost in many ways that we can't even begin to calculate. And it's
You
Yes.
nailed it.
obviously a global gazillion-dollar challenge with terrible ramifications if it's not dealt with.
You nailed it.
And
So, you
And one
know,
of the things I was going to say, Robin, is that one of the reasons I would say Faegre does it so well, and some other clients that I work with as well, is because part of what I really believe is the mission of my work is to give people skills that they
uh,
don't have to see me ongoing forever and
Okay.
ever.
I
I,
was going
I
to say the same thing. I'm like, there's an off ramp. This is not
And
perpetual.
there
Yeah.
should be. And the research echoes that as well when it comes to therapy, is that we want to break down that stigma. We also want to encourage resilience and grit, and that we use the skills that we have to get through hard things as well. And if I can just help fine tune that for people during hard moments or hard periods, absolutely yes. But I also want to be a proponent and an advocate for connection, for social connection, for looking within our systems and our communities to support each other and to make things kind of better holistically. Because, Robin, back to your initial stats where you started this conversation, I am one person, or my organization is one firm, and we can and should be, in my opinion, things like me. We should be in every corporation, and we should be working with leadership and the corporation to infiltrate the culture, so that they also should be using us as needed, but not, I should not be flooded 24 hours a day with every single employee, right? That is not the goal either. So I think we really have to start thinking about what are the other pieces of well-being and mental health, back to your question as well about those definitions, that help people to do well long term.
Mm-hmm.
And we can help, we can be reactive when things come up, and we can be proactive, and we can also be community and connection driven to support those missions so that those numbers start to drop.
So
Yep.
before we close, because I know we're getting up on time, but there are sort of three things that I think could be a part two conversation. One is, and I know we don't have time to get into it, um, the role, if any, of AI in any of this. I'm skeptical, because to me that trusted personal connection, when it's such deep issues one's working with, it's very hard to open up. I mean, it's easier, but it's still not easy.
Yeah.
And so
Yep.
there's probably a back end role right now for AI and all of that, but down the road, maybe there is a way of scaling and at least getting some level of something to be discussed in a future, unless you have some answer here. And I wonder how we help make this um, part of everybody's benefit structure. For example, I was invited to be on a research project for caregivers last year, and they were looking at what can companies offer as part of a benefit
Um,
package to caregivers who are having
oh yeah.
really difficult balancing work life when you're caring for someone who's dying, or whatever the caregiving, framework looks like for people. And this was not, we had like massive conversations with a leading academic university, with all these
Right.
famous, and this was not, there were a million really creative. This was not one of them. And it should,
Well,
Interesting.
they can call me anytime, because
but
Right.
it's how do we get in front of folks who are thinking and doing this every day and getting these kind of examples, not
That's a
only
good
from
one.
Faegre, but other companies that are finding what works, what doesn't work, and how they've tweaked it. I mean, there's something here that needs to be
Yep.
scaled for sure.
Help us, Robin. We want to do that. I mean, I think we all three have a very compelling sense of purpose around this, and could find ways to, I hope, offline collaborate on that.
Yeah, I for sure. I'm committed to doing that, because I think this is such an incredibly important contribution across the board for all the reasons we've talked about. And so the way that I'm wrapping up my sessions, and if you don't have an answer today, that's fine. You can email me later, is so Libby knows, Allie, you may know, my husband recently passed away. He had been battling Lewy body dementia, very young. And one of the things he always loved was music. And every day we curated different playlists, and music was really with us through the literally till the end, and still continues to be, though it's hard for me to listen nowadays. But I decided when I started HealthStream, I was going to curate a playlist from all of our participants and panelists and experts. If you have either a favorite song or a song that exemplifies the work that we've been talking about, Let me know what it
Oh, I
is
love
because
it.
I'm going to
Thank
add it
you.
to our Health Dame music playlist. And it's been interesting what people have sent me. So,
What you got, Al?
I love that. I love I Feel Better When I'm Dancing by Megan Trainor.
Oh,
oh,
I
It's
wonderful.
just a great song. And I do. I just feel better listening to the song and dancing. So there you have
Okay,
it.
I'm
cool.
terrible at
Okay.
dancing, but I feel better when I'm singing. So I sing Natasha Bedingfield's Unwritten.
Oh, I love
Oh,
that song.
okay, hold on. I'm old fashioned. I'm writing.
We'll send it to you too.
Okay, send it to me too. Wait, what is the Natasha one? See, I'm old.
Unwritten.
Oh, Unwritten. Yes, I do know that one. Okay,
We can
very
all go
good.
sing it.
And I feel better when I'm dancing. How wonderful. Cool. All right, ladies. Well, I just love talking to you about this, and we'll offline think about ways that we can continue the conversation. And before I let you go, Libby, what's Faegre's website? Give us a
Just
website.
faegredrinker.com. You can
Okay. How do
reach
you
out
spell
anytime.
that? Because that's
You're right. It's a tough one. Faegre drinker, because everybody knows how to spell drinker, but Faegre drinker.com, and reach out to me anytime. I love this stuff and all things health policy. So Robin, we could talk about that too.
we sure will. Allie, Mental Scope Consulting. How do we look that up?
That's mentalscopeconsulting.com. You got it.
Okay,
Yep.
that works. And healthdame.com. And thank you again for your time. And I will definitely be back in touch. Thank you,
Thank
everybody,
you.
for
Thanks,
Thank
listening.
Robin.
you.
Bye
Take care.
now. Yep.
Bye.
Bye bye, everybody.